Hello, lovely subscribers. Welcome once more to Susie Glory Health and Beauty channel. Yeah, as you all know, this channel we deal on everything health and beauty related. So today it's not gonna be our usual makeup videos, nor fascinators or other stuff, but it's gonna be a very sensitive health topic I'm going to handle today. You all know, as a healthcare provider, yeah, I have the obligation to help many of us, especially my female counterparts that are going through a lot with this topic I'm going to be treating today. So stay connected to this channel. And if it's your first time seeing me, I'm Susie Glory. I'm a Cameroonian YouTuber precisely based in Boya, Southwest region, and I'm a nurse, a makeup artist, and many. You'll get to know me as you hit the red subscription button. Thumbs up this video, like, share, and also comment. Let me know subsequent health tips you want to see from my end, and I'll be ready to deliver anytime, any day. Love you all so much, and keep watching. This topic is bam, it's very interesting, so stay connected till the end and you'll enjoy it. And yeah, today I'll be treating a very sensitive and a very troublesome topic for ladies. One out of maybe every 5 to 10 women, adolescents, go through this troublesome, disturbing, I don't know how to put it, condition, which is vaginal itches. Wow, vaginal itches, like I've been there too, so that's why I can relate with the subject in a very peculiar and very intimate way. Yeah, this is a topic that came to my mind because like it has been a topic or a subject that has really come up from time to time when we have exposés and stuff, ANC, IWC and all of that. Most pregnant women, nursing mothers and all of that always have this issue to deal with. So I decided, why not share my experiences and also my health tips with you guys. So today I'll be treating this topic under 5 headings. I'll be treating what is vaginal itches. Yeah, vaginal itches is just the sensation of, or the urge to, like, I don't know if I should use the same word, is the urge to itch your private every now and then. It's so irritating because it's like at times it grips you in the middle of so many people that you don't know how to go about it. So it's a really disturbing affair for most women. Yeah, the causes of vaginal itches in Cameroon, there is a name we usually call it. We call it sugar. Yeah, that name, I don't know if I should say it's a good name or it's like it's the right name, but there's certainly something about it. It's like sugar bitter. I could say sugar bitter because each time you itch, you feel like it's pleasant, or we could like say it's sweet, as people used to say. That's why they say it's sugar. So it's pleasant when you itch, and as it gets intense, as the itching gets intense, that's how the pleasure too gets intense. But mark you, as you keep itching, afterwards when you go to menstruate, when you go to urinate, that's when you feel the severe pain. So it's like both sweet and bitter at the same time. Anyway, there is no disease that's sweet, so I guess the name just came about because of what it does and the feeling it gives you and the urge to itch. Yeah, VHE is caused by diverse reasons. It's caused by microorganisms, some bacteria, some fungi. But today I'll be concentrating on the vaginal itches caused by fungi. Yeah, and also it is caused by some infections. It's caused by some immune conditions like diabetes. Also, diseases that suppress the immune system can predispose an individual, a female, to this condition we call VHs. Some diseases like HIV and AIDS that cause your white blood cells to drop tremendously, cancer, many other diseases that we'll name in part 2 of this because we can't really trash the topic completely. There are many reasons why you can have these VHs, and these reasons we'll all talk about them in my subsequent videos. Now, how do you diagnose VHs? V itches or this condition is diagnosed normally by the fact and its name that it itches. Now we are going to be concentrating. Yeah, today we are going to be concentrating on a particular microorganism that causes V itches. I've said it's caused by different reasons, but today I'm going to be concentrating on one microorganism, which is Candida. Candida albicans. Candida albicans is a fungi that lives in the V tract. It's normal for it to be there. It's a commensal. Commensal, what's the meaning of a commensal? It means it's necessary for the normal functioning of your V. But what happens now? What happens when it takes over and starts becoming troublesome is the fact that there are times when maybe you're on antibiotics, you're exposed to some alterations in your V flora that causes this fungi, to overgrow or to outgrow your bacteria, because there are two living in your V tract. Yes, the bacteria and the fungi, they are living at a state of equilibrium, which means they are at the state of 50-50. But what happens for it to overshadow is that, or for it to become disturbing, is the fact that you might be exposed maybe to certain reasons, conditions, and all of that, that might cause one to grow a lot, especially the fungi. So when it grows more than the bacteria, it overshadows the bacteria, and now that equilibrium is distorted, is broken, and what happens? It starts becoming a problem. It starts giving you trouble. It starts giving you these itches that you feel. Candida albicans on its own is found in the oral cavity and in the V. It's not disturbing. When it's normal, when your flora is okay, there's no problem. But when there's a distortion, that's when trouble sets in. Yeah, I would like to talk about the diagnosis of V itches caused by Candida albicans. Yeah, the diagnosis goes by, you can diagnose this by its signs and symptoms, which is firstly itches, severe itches. Yeah, severe and thick V discharges. Discharges are normal, but when they are very thick and they have a certain odor, it's not good. You need to see your physician. You can also diagnose by painful urination, because as you itch, normally you cause bruises, and when you go to pee, you have issues and it's very painful at times. You also have this um, painful pains when you're having intercourse. Also is diagnosed in the laboratory. So when you see the signs and symptoms, which is normally the first step, you need to go over to your physician to conclude your diagnosis, to know which microorganism might be causing the itches. And this subject I'll be bringing to you guys my very close colleague, a laboratory scientist. Yeah, that's going to let us know how the diagnosis is done in the lab. So that will be in part 2 of this amazing topic. Hope you're enjoying it and you're learning something. Please take your pens and your papers and jot something down. It's gonna help someone someday and help you as well someday. Yeah, guys, these are some of the medical, in fact, these are some of the medications and also natural methods you can use to get rid of candida infections of the V. So I'll start the home remedies. The home remedies, you can use apple cider vinegar. Yeah, apple cider vinegar, I don't know, it has really not been explained how it works in eliminating candida infections of the V, but it's been proven that when you use and you use to bathe daily, helps to soothe the itchy effect of the candida albicans infection. So apple cider vinegar is very important in this treatment. Also, you could put apple cider vinegar in 5 liters of water, 2 to 3 tablespoons, and you use for your sitz bath. Sitz bath is putting in a small pail and sitting on it for just the heat of the water, the vapor, to penetrate your V for about 5 to 10 minutes. Then you get up and rinse. Now I will talk about yogurt. Yogurt is very good in treating candida infections. Why? Because it's a probiotics. What's a probiotics? Probiotics are substances that contain bacteria in their inactive form, which means they contain bacteria but that are not harmful, which have been kept at a state whereby when they are introduced into the system, they just increase the bacteria population, but they don't cause any harm to the system. And what happens is that in the case of Candida albicans infection, is the distortion or the imbalance of the bacteria and the candida, which is a fungi. When one is higher than another, like in this case, the bacteria is lesser in population than the candida. So what happens is that the candida takes over and becomes now detrimental or starts bothering and disturbing by causing these serious V itches. And now what does this do? The intake of this, at least a container of this, which is about 250 ml every day, helps to introduce the bacteria into the system systematically, and it goes to boost the bacteria population and causes the equilibrium to come back to a balance. And now it's 50-50, and thus what happens? The itches disappear. You could also use this in your panty liner. What do? You take about 2 tablespoons, sorry, 1 to 2 tablespoons of this yogurt. I know it sounds very strange, but it's very, very effective. And put it on your panty liner in this manner. Always start your treatment with a clean hand. Whatever you want to use, always use a clean hand. So I always sanitize with my Cien mini sanitizer. I love that. So you take this, I'm using one hand, sorry guys, and just pour on your panty liner in a straight line, about 1 to 2 tablespoons, and then put it on for about 2 to 3 hours. Please don't let it stay for so long, because what happens is that the population of the bacteria right now in this yogurt is going to add to that of the V, and the equilibrium will be balanced. I know it sounds funny, but it's very, very effective. Try that and get back to me. Also, you could do a sitz bath with any of the antifungi over-the-counter drugs like Nystatine. You could put it also in warm water together with your cider and do a sitz bath, as I said earlier. And you can also apply this tool to your V after bathing, and avoid cleaning after going to the toilet. Avoid cleaning from back to front. Always clean from front to back, after which you use normal water without any chemical to clean and rinse, and then pat dry your V and apply either nystatine, ketolex, fluconazole. There are so many on your V. Now you insert this also, nystatine ovules are antifungal ovules. You insert 1 every night before you sleep for about medications that will be given to you by your physicians. I'm just letting you know maybe things that you might use to help you maybe before you get to see your physician. Nystatine is also very good oral antifungal tablets that also help to eliminate fungal infections. So I'll get back to you with many more or another tips to manage these infections in segment 2, as I bring you the management also and the laboratory diagnosis that will be done by my colleague and friend, the laboratory scientist. So stay connected to this channel. I love you all so much. Deal with your itches and put that smile. Beauty is from inside outside. Susie Glow is here to take care. Love you guys. Ciao, 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 ciao.